Hi everyone, this is Dr. Bill with EZ2PASSNCLEX, EZ2PASSNCLEX.com. So at this session, I'm going to be reviewing myocardial infarction, also known as heart attack. So what is a heart attack or myocardial infarction? So ideally, it's death of a tissue of the heart muscle or any part of the heart muscle. It can be related to trauma. It can be related to heart failure. So meaning it can be acute or it can be chronic, okay? So what are some risk factors for myocardial infarction, or what predisposes a client or somebody to myocardial infarction? Risk factors include coronary artery diseases, including heart failure, any blood disorders, people who have blood thinning issue or blood clotting issues, people with sedentary lifestyle, high cholesterol or hyperlipidemia, and also obesity is also one of the risk factors. So what are some classic assessment findings or signs and symptoms you're going to find with myocardial infarction? So these include chest pain that can radiate, to other areas. It could be the arm, the back, the sternum. Any type of chest pain that the client reports can be associated with myocardial infarction. That's why any report of chest pain should be taken seriously and assessed, as such. Other symptoms include sense of impending doom. They feel like they're about to die. The chest pain can also feel like a heavy pressure. They may describe it as an elephant standing on the chest. That's also another classic symptoms. Other symptoms include shortness of breath, tachycardia, diaphoresis. So basically they sweat a lot. They can possibly have syncope or pass out if they have decreased cardiac output excessively. Weakness, fatigue is also another classic sign and symptom of myocardial infarction. So what are some diagnostics? EKG, rapid EKG. You have to do an EKG right away. You're going to do some cardiac enzymes through blood. So you're going to draw blood and assess for CBC and BNP as well as cardiac enzymes. And these can include myoglobin or erythrocyte sedimentation rate. You want to see inflammation, sign of inflammation as well. And then another classic diagnostic is troponins. Troponins are really also important assessment factors in myocardial infarction. So nursing interventions include encouraging the patient to sit or maintain calm, because the more anxiety they have can also increase oxygen demand by their cardiac muscle, which also worsens the condition. Okay, make sure you place the client on oxygen. Okay, you can administer some morphine. The morphine can reduce the anxiety, which in turn can also reduce the oxygen demand, and it will address the pain as well. Aspirin is used for the blood thinning and also can help improve blood flow to the areas. And also nitroglycerin, which is very important. Nitro is also a vasodilator, which helps reduce the cardiac demand as well, and also relaxes the blood vessels that lead to the heart. So you can use the acronym MONA. MONA is an acronym that will help you remember the classic treatment or nursing interventions or nursing implementations to treat myocardial infarction. So morphine, oxygen, nitroglycerin, and aspirin, MONA. Okay, you want to promote bed rest until, further investigations or further assessments are completed. And then when the pain resolves or when the findings are identified, we can further defer the client to cardiac catheterization for further investigation of what led or may have caused the myocardial infarction. Some nursing education include teach about weight loss, diet. They need to decrease cholesterol in diet, medication management and compliance is very important. Increase activity, so exercise, 2 to 3 times a day. They can do brisk walking and then advance as tolerated. So that is myocardial infarction education that you would provide to the client. And that wraps up, or that summarizes myocardial infarction. Thank you for listening and watching EZ2PASSNCLEX. Thank you.